Welcome to our special series on peritoneal dialysis, and joining us to help demystify PD is Dr. Marianne. So thank you so much for joining us today, Dr. Park. I thought we could start by having you explain what is dialysis and when in a kidney patient's journey do they need to start dialysis?
So dialysis is a therapy that removes waste, salt, and extra water from the body when our kidneys are no longer able to do it themselves any longer. It can also keep certain chemicals in our bodies at balance as well, such as sodium, potassium, and bicarbonate levels, again, when the kidneys are no longer able to regulate this anymore. Patients with chronic kidney disease over time progress and develop end-stage renal disease, at which point generally patients require dialysis as a life-sustaining therapy. And we know that patients require dialysis because of a few different features. First being the actual biochemical features. So when we're doing blood work and we see that patients are developing high levels and sometimes dangerous levels of certain chemicals in the body, we know that we need to start talking about dialysis to keep things safe for the patients. Other times, these are signs and symptoms that patients develop over time that gives us a clue that they're nearing requiring dialysis. So for example, patients may develop signs of volume overload, meaning developing shortness of breath, increasing weight gain, and swelling around their legs or other parts of their body. Or patients may develop signs of uremia, which are symptoms that develop when patients have toxins build up in their bodies from their kidney disease. And some patients may say they have increasing fatigue, loss of appetite, increased itching, as well as nausea and other abdominal symptoms as well. Again, all of these signs and symptoms with their blood work combined generally gives us a sense of when patients need to start dialysis.
So I understand that there are generally two types of dialysis, peritoneal dialysis and hemodialysis. Can you briefly explain the difference between the two?
Yes. So hemodialysis is a type where it's intermittent typically, and patients require their blood to go through a hemodialysis machine to get it cleaned of all of these toxins and the extra water for removal. And then the same blood is then returned to the patient. And each session like this can generally take about 3 to 4 hours for completion. And patients require this approximately 3 to 4 times a week. And of course, the actual duration and the frequency depends on each patient a little bit. This type of dialysis can be done in a hospital setting, or in a dialysis unit away from a hospital, or in their own homes. Peritoneal dialysis is more of a 24 hours a day, 7 days a week type of therapy, where patients always have a special fluid called dialysate in their abdomen. And this dialysate helps draw out the toxins and the fluids, which then you subsequently drain out of your abdomen to get rid of the waste products. This type of dialysis is always done at home, not in a hospital setting. So peritoneal dialysis is referred to as one of the home dialysis modalities in dialysis.
So how does a patient decide what is the best type of dialysis for them?
So we leave a lot of the decisions up to the patient to decide what type of dialysis works best for them, because all types of dialysis, whether it be hemodialysis or peritoneal dialysis, are generally equal in terms of effectiveness, in terms of clearing the toxins, and in terms of the longevity of the patients who stay on dialysis. The features that we think are important to consider are mostly lifestyle considerations for each of the patients to determine if a particular type of dialysis is better than another type of dialysis. So for instance, patients who are still actively working and require a lot of flexibility in terms of what time of day and how frequently they can do dialysis, we think that home dialysis is better because it offers a lot more flexibility in terms of how often and when to do their dialysis. Patients who also value traveling a lot find it a little bit difficult to do other types of dialysis other than home dialysis, because there are a little bit more restrictions in terms of when and how you can travel to ensure that you can continue getting dialysis at your travel destination. So patients who do home dialysis are able to continue doing their dialysis in their home, in their travel destinations, which makes it a little bit easier for them to travel as well.
So for patients considering peritoneal dialysis, probably one of the big advantages would be that it is done at home and it does allow them to have that flexibility. Are there any other things that would make a patient a good candidate for PD?
I think patients who are motivated and demonstrate interest in doing dialysis themselves at home to gain the benefit of that extra flexibility as well as independence over their own dialysis care are generally all quite good candidates for home dialysis. There are a few instances where we do feel that peritoneal dialysis may not be the best type of dialysis for you. And generally, there's very few medical contraindications, but the few that we do think about include patients with frequent bouts of diverticulitis or have inflammatory bowel disease, because these patients tend to have more adhesions or scarring in their abdomen. And similarly, patients who've had a lot of abdominal surgeries in the past or a lot of infections and complications in their abdomen, we also find that because of the adhesions and the scarring, sometimes peritoneal dialysis is not as effective. And in instances of diverticulitis and other infections, it also increases your risk of developing abdominal infections with peritoneal dialysis as well. So we worry a little bit more about these patients, and it's individualized patient to patient to decide if it is a good idea to start peritoneal dialysis for these patients or not. Other personal and more social factors that we do think about are whether if patients actually have enough space in their homes to have PD-related supplies in their homes to be able to do peritoneal dialysis, and whether they can physically do things such as picking up their dialysate solutions or making connections for peritoneal dialysis to happen for their exchanges. And of course, we have lots of ways to get over these barriers as well. So if they have a dedicated caregiver or a partner, family member who can assist these patients with some of these activities, it's certainly absolutely possible to train these patients for home dialysis, and they can work as a team to continue providing home dialysis for these patients.
Stay tuned for more of our special series on peritoneal dialysis with Dr. Marianne Park.